Are you or your loved one struggling with severe hip pain that limits everyday movement? What if we told you there's a faster, less painful way to walk, move, and live again? Welcome to the future of joint care, minimally invasive total hip replacement surgery. In a traditional hip replacement, surgeons make a large incision and cut through muscles to access the hip joint. But in minimally invasive hip replacement, we use a much smaller incision, just 3 to 5 inches, and go between muscles instead of cutting them. This means less pain, smaller scars, quicker recovery, lower risk of dislocation. This surgery is ideal for patients suffering from severe osteoarthritis, hip fractures, or joint degeneration who have not responded to medications or physical therapy. During the surgery, the damaged bone and cartilage are removed and replaced with a prosthetic joint made from high-grade metal, ceramic, or plastic. Because the incision is small and muscles are preserved, patients typically experience much less pain after surgery. Most patients start walking within a day or two after the procedure and return to normal activities much faster than with traditional methods. On average, full recovery takes 4 to 6 weeks compared to 3 months with conventional surgery. Before surgery, even getting out of bed was painful. Just 5 weeks after my minimally invasive hip replacement, I'm back to gardening and walking my dog. If you or someone you know is considering hip surgery, ask your doctor about the minimally invasive option. To learn more or book a consultation, click the link below or contact us at the number on screen. Start your journey to pain-free movement today. Minimally invasive hip replacement. Faster recovery, less pain.